Do you have Helicobacter pylori overgrowth? What are the symptoms and how to test for Helicobacter pylori? Hello everyone, I am Tina. I am a nutritionist and working with irritable bowel syndrome, and today we will be talking about, do you have Helicobacter pylori? So Helicobacter pylori is a type of bacteria that infects the stomach lining and can cause various gastrointestinal problems. Many people infected with Helicobacter pylori do not experience any symptoms, but when symptoms do occur, they can range from mild to severe. So common symptoms associated with Helicobacter pylori infection include gastritis, which is an inflammation of the gut lining. Gastritis can lead to symptoms such as abdominal pain, bloating, and feeling of fullness or discomfort after eating. It can also cause peptic ulcers. Helicobacter pylori is actually a leading cause of peptic ulcers, which are open sores that develop in the lining of the stomach and the upper part of the small intestine. So symptoms of peptic ulcers can include burning stomach pain, often occurring between meals or during the night. It can also cause nausea and vomiting. That some individuals with Helicobacter pylori infection may experience, especially if the infection leads to gastritis or peptic ulcers. So loss of appetite is also one of them. So where Helicobacter pylori can sometimes cause a decreased appetite, leading to unintentional weight loss. And also burping and bloating, where excessive burping, bloating, and feeling of gas in the stomach are common symptoms associated with Helicobacter pylori infection. And also anemia, where in some cases Helicobacter pylori infection can lead to chronic blood loss from peptic ulcers causing anemia, and anemia may also result in symptoms such as fatigue, weakness, and paleness. And also changes in stool. Bleeding from peptic ulcers can cause the stool to appear black and tarry, sometimes involving blood in stool. So all of these can be signs of Helicobacter pylori overgrowth in the gut, but not everyone infected with Helicobacter pylori will experience symptoms, and also some of the symptoms mentioned can also be caused by other gastrointestinal conditions. A healthcare professional can perform tests to confirm Helicobacter pylori infection and develop an appropriate treatment plan for you. So complications in relation to Helicobacter pylori. There can be complications associated with Helicobacter pylori infection, including chronic inflammation of the stomach lining and also stomach cancer. So Helicobacter pylori infection is a strong risk factor for certain types of stomach cancers. And that is why it is important that you get tested for Helicobacter pylori if you experience these symptoms. So how to test for Helicobacter pylori? So as a nutritionist working with irritable bowel syndrome and gut-related issues, in my clinic we use the so-called GI map test for testing Helicobacter pylori overgrowth and other types of dysbiotic bacteria, where Helicobacter pylori is one of the bacteria types included in this particular test. However, you can also get tested for Helicobacter pylori through your GP's office, where they are able to take some stool tests or do some other types of testing and send it for analysis, and it only takes a couple of days to get results. How to treat Helicobacter pylori? If you choose to treat Helicobacter pylori through your general practitioner's office, the treatment usually involves a combination of antibiotics to eradicate the infection and promote healing of any ulcers or inflammation. The duration of the treatment typically lasts 10 to 14 days, depending on the specific antibiotics used and the severity of the infection. It is important to follow the prescribed treatment plan and to complete the full course of medications to ensure effective eradication of the bacteria. Alternative treatment options for Helicobacter pylori is to treat the condition naturally. I have done another video on how to treat Helicobacter pylori naturally, and I've put a link down below so you can go and check it out. Thanks for watching.